We'd like to remind you that if you are experiencing symptoms of a heart attack, stroke, or any life-threatening medical emergency, please call 911. Please do not delay seeking treatment during the COVID-19 epidemic. Most Providence emergency rooms are open, and CDC-required safety measures are being taken to protect patients and hospital staff. If you are unsure of your symptoms, please use our telehealth services and speak with a healthcare professional that can better assess your symptoms and provide direction on the best course of action. Please do not let the worry of COVID-19 cause delay in seeking out treatment if you are experiencing a heart attack or stroke. Every minute treatment is delayed can be fatal. Thank you.
Hello, everyone, and welcome to Talk with the Doc, the show where we bring your questions to Providence medical experts for insight and information. I'm your host, Mary Renoff, and here with me today is Darrin Godin, who was the first COVID-19 patient we had in our Orange County hospitals. And although Darrin's not a physician and he's not a doc for Talk with the Doc, he is going to talk a little bit about the healthcare that he received. And we are going to answer your questions about his COVID-19 journey. So remember, everyone, all of our questions come from you, our listeners, via social media. We can be found on Twitter at Providence and under Providence Health System for Instagram, Facebook, and LinkedIn. Use the hashtag Talk with the Doc for a chance to hear your questions on our episodes. Before we start, I want our listeners to know that the information provided during this program is for educational purposes only. You should always consult a healthcare provider if you have any questions regarding a medical condition or treatment. So let's begin by welcoming our guest, Darrin Godin, Chief of Staff at Orange County City of Hope, and my former Providence fellow caregiver or employee. Darrin, thanks for joining us.
Thank you, Mary. Thank you for having me. I really appreciate it.
Absolutely. Well, Darrin, I think many people want to hear your story because not only are you a COVID survivor, blessings, you had no previous chronic conditions or underlying health conditions. You're young, you're healthy, you're fit. So you were very surprised to get this diagnosis, I would assume. So can you start by just sharing your journey with us?
Yeah, just the short of it is, the weekend before I was hospitalized, which was on a Tuesday, began to get a high fever. That started Saturday morning. Previously to that, Thursday night had a headache, took some over-the-counter cold medicine and thought I would just sleep it off. The next morning, took a shower, got out of the shower, had a little dizzy spell, thought it might be related to the cold medicine, felt fine, went to work, was fine all day, was fine that night actually. Woke up Saturday morning with 103 fever, started treating that with some ibuprofen, that sort of thing, drinking lots of fluids, and it just continued all weekend long. And so by Monday, I had developed a cough as well, and told my wife, I was like, "Do you think this could be coronavirus?" And we kind of laughed at it a little bit and thought that, it could be, but maybe not. I called did a virtual visit with a doctor through my insurance company on Sunday night. Took 7 hours to get a call back on that. And they said, it sounds like the flu, just drink lots of fluids, rest, that sort of thing. Prescribed me some Tamiflu. By Monday, I was feeling worse. And Tuesday, I decided to go looking for a testing facility that I'd heard was somewhere near St. Joseph Hospital of Orange. But I decided at the last minute to go ahead and call Providence Express Care as well, thinking that if I found the facility to get a test, they might want a doctor's order. So I called them, and it was then when I found out that they thought I should go to the emergency room. So that's how I ended up at the ER at St. Joseph Orange.
Wow. It's so amazing. I think a lot of people in the early phases were told it was the flu. I was told it was the flu, and I said, I had a flu shot. I don't know. I don't feel quite like it's the flu. You did a virtual visit, and then you went to an emergency room, and you chose a Providence facility, which we're so glad, right? Tell us a little bit about that experience. Why did you choose virtual?
Yeah, so I'd already, like I said, it took 7 hours for the other one through my insurance company. And so what I thought was Express Care knows the geography. I know they're local. They'll probably know if there is a testing facility at St. Joe Orange, which is my hospital of choice anyways. And so when I called, I was really grateful that the provider that I was connected with went through all the symptoms, and she consulted with somebody, came back on the line and said, you need to go to the ER right now. And she said, how close are you to the nearest hospital? I said, I'm near St. Joe Orange. I'm about 10 minutes away. I pulled off the freeway to take the call, or, connected via video on my app. And she said, go right away. And I said, well, I was really just hoping to get a test because I figure, I've seen it on TV. If I'm positive, I'll just go home and isolate and do that sort of thing. And she said, no, based on your symptoms that you're telling me, she said, we think you should go to the ER. So she called them to let them know I was on my way. And when I arrived, they were ready for me. There was a nurse out there already, and the valet guy badged me into the parking lot, said, "Park your own car." I parked my own car, walked up to the nurse. They took my temperature, put a mask on me, and all within about an hour time frame, I was already having a chest x-ray, and the chest x-ray came back with the information that the doctor said he was pretty certain would be coronavirus based on the pattern that was in the lungs. And so I had bilateral pneumonia. And then he said they would test that or confirm that with a nasal swab, and that came back 2 days later that I was indeed positive. So I chose the virtual visit because I felt like they were close, they knew the area, they knew the hospital, and I trusted them. So have used it before, and it was very helpful.
Yeah, I'm a big virtual fan when I don't want to expose other people to my symptoms. So obviously a good choice on your part. I think, a lot of people know that Providence had the first coronavirus case in the US, but people may not know you were actually the first coronavirus case in our Orange County, St. Joseph area. Yeah.
Yeah. So at St. Joseph Hospital, I was their first patient. I didn't know that until after I was ventilated and off the ventilator is when I actually found that out. But they had been preparing, and they, just like, the rest of the health system, had been getting ready for this and doing all the training and so forth. So I was there first when I arrived. It was actually pretty scary, Mary, because the nurse that came out was wearing like a full-on spacesuit. We're similarly aged, so remember the movie E.T.? It felt like that scene from E.T. The tent was set up outside. They came out with a full PPE, the protective equipment, the mask over the head, everything, and I was like, whoa, this is pretty serious. And then when they took me into the ER, they took me through a side door straight into an exam room. I didn't see anybody else. And then everybody that came in to treat me or work with me were all wearing the same thing. And so I actually was pretty scared of myself once I was seeing all that, because it became real to me that this is not just your everyday flu or cold. This is something that's highly contagious. And if I have it, that's going to be pretty scary. So, yeah.
Well, what's interesting is you had spent years, right, in our own system telling about how great the care is and the wonderful workers, but you probably hadn't really experienced a lot of it firsthand. But I know you wrote a 4-part, I think, series in Facebook, which I can't even reread because I cried through the entire thing, and I tried to reread it to my father, and I cried the whole time. But talk a little bit about the care you received, because I know you've been very vocal about that.
Yeah, I have been. And the reason why I chose to write about it was, well, first of all, it was very therapeutic for me. When I was released from the hospital, I've been out now, gosh, almost 5 weeks, I guess, and the recovery has been pretty slow. We could talk about that in a little while, but I felt like I needed to start talking about it. I had already been talking to my wife, and every time she and I would talk about it, we would just cry. But I felt like I needed to write about it. I've been in communication for a long time, and so the thing I knew to do was to start putting words to paper and telling the story, as well as working through and processing some of the feelings and emotions and stuff I was going through. So so I started doing that, and it really helped me because I was also kind of feeling a little bit like, I would say, probably a little sense of depression, even though I was extremely grateful for being alive and realizing how close I came to not making it. I was so happy, and I was happy to be home with my family and my kids and my wife. But yet there was like this weight on me, and it was, the best thing I can describe it is depression. I've not really dealt with that a lot of my life. And so writing about it seemed to be really helpful. And as I began to express it, it was super long. And so I thought I'll do this in multiple parts, and people started leaving their comments, and that was really helpful. I was expressing the care I received from St. Joe Orange, from the entire care team, from the doctors to the nurses, the respiratory therapists, the lab folks. I mean, everybody that was working my case was just awesome and wonderful. But then I began to hear from them as well as I started to tell the story, and that was extremely helpful as well.
Well, you had an amazing care team, and you had an amazing family support network, but I think people may not know you had a huge prayer network. You had a Facebook group of people praying for you. I know I had the Sisters of Providence and the Sisters of St. Joseph praying for you. We were all praying for you. Talk a little bit to me about kind of the spiritual nature of what this pandemic has done for people.
Yeah, well, I'll go from my own perspective and from my wife's perspective. once I was in the ER and the doctor said he thought I had COVID, he was pretty sure, and that they would be admitting me. I called my wife and I was crying because it was so real at the time and it was so scary. And, she thought, she's a nurse, but she's not practicing right now. So she said, they're probably going to hydrate you, give you some IV fluids, that sort of thing. She's like, you'll probably be home in a couple days. You'll be fine. And so while she said that, it was reassuring, but at the same time, it's still very scary. And so I don't actually remember a whole bunch of that first week because I did continue to get sicker and sicker, and breathing became even harder. And they kept increasing my oxygen and that sort of thing, and trying different masks on me to see if I could get more oxygen and that sort of thing. So that was a Tuesday, and by Saturday I was put on a ventilator. I was intubated and on the ventilator then for 9 days. So yeah, I don't remember a whole lot from that first week, but I remember being very scared. I called another friend of mine as well, and I remember him being very encouraging from the ERs, just saying, you're going to make it through this. You're going to be fine. We're going to pray. On that Saturday morning was the worst for me. I called my wife. I told her that I could barely breathe. I also called my friend and I told him. He again encouraged me. And I guess after that call, he felt so strongly that he called my wife and he said, we're going to start asking people to pray. So he got all these people to record videos for me and he was sending them to my phone. But at that point, I was already I wasn't even touching the phone. All I was doing was focusing on trying to get breath because I really didn't want to be intubated. But he reached out to a bunch of folks that spread like wildfire. And, it got to you as well and to Morgan and others on the team. And so when I was finally off the ventilator, it literally ended up being thousands of people from all over the world, all across the country, churches in other parts of the world, people that I don't even know if they go to church or not, but were sending me messages. The sisters themselves sent me just incredible cards. I got home, I had at least 20 cards from the Sisters of St. Joseph, just letting them know that they were thinking about me, praying for me, and giving me encouragement. It was really moving. In addition to that, the caregivers themselves at the hospital, I had so many people say, can I pray for you? And I was like, yes, you may. And I've heard stories since then of even while I was on the ventilator, nurses and respiratory therapists and stuff just encouraging me and praying for me. And it's incredible to know that they weren't just taking care of my sickness. They weren't just taking care of my body, but they were looking after me as truly what we call that whole person care. And they were looking after my spirit as well. And the best way they knew to do that when I was in a coma was to pray and ask God to intervene. And I'm certainly so glad that he did. And I'm thankful for everybody who was standing in faith for me, as well as fighting for me when I felt like obviously I couldn't fight for myself. And my wife also, from her perspective, she was very optimistic at first, very sad when she heard that I was intubated. We didn't get a chance to talk to each other before they intubated me. And so that was for her a scary moment. And then the rest of the week, as she would get the updates over those 8 nights, 9 days, things got worse. And they started talking to her about, if he doesn't improve by tomorrow, we may need to move him to a different hospital so he can go on an ECMO machine, which is not only would breathing be done for me outside my body, but also my heart would be, that function would also be taken over by a machine. And my wife just really felt, after working with the care team and understanding from their perspective how much they were working for me as their first official COVID positive case, that she just felt like that wouldn't be a good idea if they had to transfer me. She thought that would be not good for the team either, that they really needed this victory and they needed this win. And so she just started to pray that wouldn't happen, and that I would begin to recover there at St. Joe Orange, and that I would come off the ventilator there and I would walk out of the hospital there at St. Joe Orange. And pretty much all of that happened except for the walking out part. I had to be wheeled out, but still, yeah, just so thankful for all the people who were standing in faith for me, including yourself, Mary. So thank you.
I'm going to get through this without crying. I made that promise to everybody, but I still have people texting me and sending me messages saying, how's your friend Darrin? And they're still praying for you. And it was my bad not to continue to give a lot of updates, but strangers, and you know me, right? I work in the influencer field. You had NFL players praying for you. You had MLB players. I mean, there was a big group of people, But you just mentioned your wife kind of being a little bit of your advocate while you couldn't talk. And I think one of the things about your story that touched me so much was that she kind of went to bat for you and said, let's flip him. Let's test this, because we're all learning, right? Nobody knows how to deal with COVID. We're all learning. She had done the research, talked to other groups, and your care team was happy to listen to her and make that choice. So can you talk a little bit about how she did that?
Yeah, so she has a friend that she went to nursing school with who is an ICU nurse in Georgia, and I think they had already had some COVID patients, and she had been treating patients with ARDS, which is acute respiratory distress syndrome, I think is what it's called, which is eventually what I had, and many folks were treating it like just the respiratory disease, and we've since learned in the weeks and the last month or so, it's much more than that, and it impacts different people different ways, and we're continuing to learn that. So her friend said, based upon all the numbers, my wife's never worked in an ICU, so she didn't get all the like pressure numbers and all that stuff, but she takes copious notes. She was sharing those with her friend, and her friend said, gosh, if these numbers don't change over the next couple of days, you should really inquire with this care team about proning him, which is turning him from his back onto his stomach. So Katie did that, and I wrote that it was dismissed. It wasn't really dismissed. It was, the reasons around it were fair. It takes a lot of people to turn a guy over when he's 200 pounds. I'll go with 200. It was a little more than that. Turn him over, and then also all of the tubes and all that other stuff have to be considered, as well as it's also highly possible that you will expose more people to the virus at that time. And so for St. Joe Orange at first, from what I understand, the doctors were thinking that they were optimistic that in my current position I would do just fine. But as I said, things did get worse, and the care team did make the decision to do that. And I understand the way they did that was the day shift stayed a little bit late. The night shift had arrived with a nurse manager as well. They had the crew to do it, and they flipped me. And that was what began to make a difference for me. I began to improve after that. And then they continued to do that for the rest of the time while I was on the ventilator. I wish one of them could be here to like talk about those things too, because I've had doctors call me and they tell me things that were going on. And it's just incredible to hear from the other perspective as well of what they were thinking and what they were feeling, that sort of thing. But yeah, I do feel like Katie advocated for me on that. And but the doctors themselves as well, they would continually tell Katie that that they were always looking at the research. They were looking at new articles that were coming out. They were finding out what other people were doing and other things that were happening and how they could best care for me. My current employer, City of Hope, Orange County, even doctors from City of Hope consulted on my case and gave some suggestions and so forth. And so they tried different drugs on me as well. And I'm just so grateful, like I said, in the way I wrote about it, that there was an army out there fighting for me. It wasn't just the people praying. It wasn't just the nurses working in the room or the doctors making the decisions. It was truly a care team that they were getting the information from wherever they could get it and threw the kitchen sink at me. And by the grace of God, it worked. And I came off the ventilator on the 9th day. So.
Well, and interestingly enough, I've actually been in some of the COVID units across our system, and I've seen some of the patients flipped. And what I really liked about that was watching their care team talk to them, even though most of them were sedated or kind of in a, a medical induced coma. They talked to them, they touched them, they told them what was happening. And I know you talked about that as well. Your nurses were having full on conversations with you, even though you may not remember them. What did it mean to you to hear that later?
It was incredible. So I told the story as I wrote about my story. It's because I only knew what I knew at the time. A respiratory therapist named Tyler came in my room after I was off the ventilator, and he had been off for a few days. And he came in, and I was already asleep, but he knocked and said, "May I come in?" And he came in, and he introduced himself, and he just said how happy he was that I was alive, and he had worked on me while I was on the ventilator. Still, the medicines were still clearing my head, so I didn't quite have a full understanding of everything that meant. But he said he would talk to me. The nurses would talk to me. I've since heard the story of the first few nights I had this nurse named Sydney, and now I'm going to cry, so I'm going to try not to do that. She wrote me, and then as I read what she wrote and talked to my wife said, "Oh my gosh, she would call me from the night shift, which normally the day folks would call or the doctor would call, but she called and she said, what kind of music does he like? And my wife said, he really likes country. She's like, I knew I would like him. And she said, he's also, he likes worship music and stuff. So she's like, all right. So asked about my family, those sort of things. And I understand that she stayed in my room for like 9 hours that night. And she just talked to me, and she would just talk to me about my kids and tell me to fight, that sort of thing. She'd play the music for me. Mary, I can't tell you how much that means to me to know that, I'm sedated, I'm on paralytic medication. I don't remember any of that. She put herself at risk, 9 hours in that room. And again, I don't know if that's normal for the ICU or not, but it doesn't feel normal when there's this virus that she could be infected with. And so to know that somebody was there talking me through it and encouraging me for those entire 9 days. She wasn't the only one. Other nurses and respiratory therapists did the same. And I'm just so grateful for that, because I know I was scared when I was intubated. That was one reason that my wife was just feeling so downcast about it, was because she wanted me to go, if I needed to be intubated, she wanted me to be in that place of just standing strong and firm, and she didn't feel like I was in that place when I had to be intubated. And so I'm just so thankful that people did that for me, and fought for me.
Well, and especially because, when you're in that situation, your wife wants to be with you and holding your hand and touching you. And in this situation, our families can't be there. And so I think the nurses are stepping up, and they're playing not just caregiver and care provider, but really family support.
They are. And it's not lost on me that we're doing this today, and Nurses Week begins soon, and we're celebrating them. And certainly the doctors, nurses, frontline caregivers, and many other essential workers have been getting a lot of attention and praise during this. But I'm just thankful that it's this week during Nurses Week, because I've had many of my doctors call me. I've had many of the nurses reach out, and I just want to give honor where honor is due. They are the ones who God empowers to do the work that they do. And I'm aware of that. And I truly believe that while all these people were praying and standing in faith for me, I believe that care team was being empowered supernaturally to do the best thing that they could do for me and make sure that I lived and came home to my little boys and my wife. And they were more than just caregivers. They were being that family. I know that there's a drive going on now from a doctor at Children's Hospital of Orange County. You may have seen him. He's the dancing doctor.
Yeah.
He's been doing this drive to get iPads or old iPhones or this sort of thing for St. Joe Orange, so that patients can have that live connection via video with their family. And I just think that's incredible, because that's such a missing thing right now for COVID patients. You're isolated, you're alone, and even though you can talk on the phone or whatever, that video link, I think, is important. So
the face, just seeing the face, it matters so much.
Yeah.
I believe all of our doctors, nurses, but even people like you and I believe that you're called to work at this mission. I think we all are. I came from sports and entertainment into healthcare, which was confusing for many people, but when you're called, you're called. So
yeah.
So Darrin, we talked about the fact that you didn't have any underlying conditions. You're a fairly healthy dude. Talk to me about the recovery, because we've been hearing that the recovery is really rough. Some people can't even stand up on their own for a while. How is it going for you?
So the recovery is very slow. I am about 5 weeks out right now. I plan to go back to work next week. So I've been off this whole time. The doctors say for every day you're on the ventilator, and I would probably add some of those days when you're just laying in the hospital bed, you need to plan for a week of recovery. The first day, it was probably a couple days after coming off the ventilator. I actually came off the ventilator on a Sunday and I went home on a Wednesday. I pushed that with my doctors. Actually, I just really wanted to be with my family. I wasn't having any other symptoms. All my blood work was coming back normal. My chest x-ray was coming back good. So they agreed that if physical therapy did the assessment, and they agreed that I could go home that day. Physical therapy came in. They had me stand with a walker, and I had to use every ounce of my ability to will myself into being able to demonstrate that I could move with a walker. It was very difficult. For the first 10 days I got home, I had to walk with a walker. I was very unsteady on my feet. Pretty much had no strength. Could not pick up the kids whatsoever. Even picking up a glass of water was difficult. My fine motor skills were severely impacted. Had a little bit of neurological slowness as well from all of the sedation and that sort of thing. Yeah, the recovery was really tough. As a communicator, I was having a hard time finding words. I couldn't write like I did. I tried to write, and my writing was impacted. So there was a lot of things like that. So it's been taking a long time. I have been trying to push it to go faster. One of my doctors called me yesterday to check in with me, and he said, I told you a week for every day. And he's like, that's still a ways away. And I said, well, I'm feeling better. I feel about 90 to 95%. So yeah, I don't think people realize how much that takes a toll on you. As well as the COVID virus itself seems to have some just crazy effects on different parts of your body, everything from your brain to your lungs to your heart, other organs. Luckily, I didn't have much of that, no organ failure, that sort of thing, but they're still learning about it. And so, yeah, the recovery has been very, very slow.
Are you using, I know that a lot of the COVID patients are having kind of like at-home care and support provided and even monitoring. Are you using any of those services?
Yeah, so I'm done now, but when I was discharged, they discharged me with home health, and it was going to be a remote monitoring through St. Joseph Home Health, I think it was called. So actually used an app, I think, that has been created by the system called Twistle. And so 3 times a day, I would check in. They would send me a text, and I would check in. They sent me home with a pulse oximeter to measure my blood oxygen, as well as a thermometer to take my own temperature. And then I would report my pulse ox, my pulse, my temperature, as well as how many breaths I'm taking a minute. And I would answer some other questions about how I'm just generally feeling. And then a home health nurse would call occasionally as well, just to check in as well. So I did that for about 2.5 weeks before I was discharged from that. And I thought that was a pretty good way of checking in and them keeping a tab on me without having to go in and be exposing to anybody else. And of course, I've had follow-up visits with doctors and virtual visits as well. So.
Well, talking about exposing other people, we've got some questions coming in, and some of them are, did your family get COVID as well?
Yeah, I know we're short on time, but yeah, so Katie got tested once I was in the hospital and confirmed. The health department did reach out to her, and she got tested, and she was positive as well. She had a couple days of symptoms and was feeling fine after that. She didn't have anything else, and she did isolate for about 4 weeks, even though they told her 14 days was what was required. She didn't leave the house at all. My in-laws would come over to help, but they'd stay outside and bring stuff. We had that whole army of people bringing food and everything and supplies and everything, which was great. But I also should mention, my current employer, City of Hope, Orange County, the team there, I know many of them from previous roles and so forth. They were so compassionate, so caring. I mean, they also provided for my family and took care of my wife and kids. And I'm just so grateful. You guys were praying. I know people were sending stuff to the nursing staff. Greg Till, the head of HR, sent pizza to the ICU team. And I just thought, how awesome is it to be part of a big family? And we're all in healthcare. We're all serving patients in this area. And I just think it's awesome that we can come together and regarding of our brand and come together and say, we're here because this is what we're called to do, like you said, and take care of people. And just awesome.
Well, somebody asked if you have considered donating plasma for research.
I actually did that. My birthday was on Saturday, and the Thank you. The Red Cross is the one who is acting as kind of the clearinghouse for collecting that convalescent blood plasma. And they called me and scheduled me last week, and they scheduled it on Saturday morning, which was my birthday. So I thought that was a great way to be able to pay it forward and hopefully help someone else in their fight. So yeah, I did that. It took about an hour and a half. Wasn't too painful. It's like kind of giving blood just a little bit longer. And so I don't know who that plasma went to, but I am believing that it's going to go and help somebody else who's in a bad place right now with COVID, and hopefully it helps them to recover much quicker and maybe keep them from a ventilator, which means they'll recover even faster. So yeah, it's a pleasure to do that.
This birthday must have been like, I mean, it must have just meant so much to you. I'm not going to cry. I'm really not. But
right. Yeah, it really did. I mean, we did a low-key celebration, obviously, because everyone's still in quarantine. But yeah, I used to not want to talk about my age, but now my headline for my birthday was alive at 45, not dead at 44. And I'm happy about that because, Mary, as I see the numbers and I see the statistics of the people that are dying, for me, those are not just numbers. Those are not just statistics to roll on the side of the screen as the news gives the reports. It's not for political reasons or for economical reasons for me. I look at those numbers and I think every single one of those people who have died, they were just like me. They're just like you. They probably never expected to get as sick as they did. And they have family, they have loved ones. They might have kids or parents or whatever else, people that love them and care for them. They have dreams, they have plans for their life, and their outcome wasn't like my outcome. And it's not lost on me that I won't use the word lucky because I don't think it's luck, but I think God is using that and using that story. But I think about those folks and those families that are impacted by it. And I'm just so thankful where I ended up, but I pray regularly for those folks and for those families, because it's not an easy thing, and loss is terrible. So.
Well, we are so grateful that you've made it through, and so grateful for you for sharing your story, because I know that it matters. And if nothing else, it does explain to people that it's not just the elderly, it's not just the super sick. There are a lot of people getting sick, and this staying home and staying safe and taking precautions, it matters. It really does. So thank you, Darrin, for joining us today and for sharing your story, and everyone for listening and sending in your questions. We look forward to future topics with more experts from Providence. We can be found on Twitter at Providence and under Providence Health System on Instagram, Facebook, and LinkedIn, and we look forward to you joining us there to share your questions. And also, if you have any topics that you would like us to consider, please use the hashtag TalkWithTheDoc and submit them in social. Thanks for listening.